All right. So, hello and welcome, everyone. My name is Olga Kagan. I am the founder and the president of the Food Allergy Nursing Association. I'll be moderating our panel discussion today. We will talk about food allergy educational resources for nurses and other healthcare practitioners. And this activity is approved for one contact hour continuing education by the American Association of Nurse Practitioners, and we will share how to claim those contact hours at the end of this presentation. Today we have three amazing speakers with us. Let's see, maybe we'll do slideshow. Here we go. And first and foremost, I'd like to welcome Kim Mudd, who is a nurse manager at Johns Hopkins Medicine. She received her baccalaureate degree in biomedical science from Western Michigan University, her BSN from Johns Hopkins School of Nursing, and her MSN with certificate in health policy from the University of Maryland. She started her allergy career as a laboratory research technician 38 years ago and is a current nurse manager of the Johns Hopkins Division of Pediatric Allergy, Immunology, and Rheumatology Food Allergy Research Team. Kim has a long history in food allergy research, education, and community advocacy. She has multiple publications and has received many awards for her work in the area of food allergy. And she is the lead author for the American Academy of Allergy, Asthma, and Immunology Oral Food Challenge Educational Series, which we will talk about today. So welcome, Kim.
Thank you.
We also have with us today Maria Crain, and Maria is advanced practice registered nurse, is a pediatric nurse practitioner that specializes in food allergies, and she was initially PNP at the Jaffe Food Allergy Institute of Mount Sinai Medical Center for 5 years, and I know she lived in New Jersey, so we just talked about the weather. And for the past 15 years, she has been the nurse practitioner for the Food Allergy Center at UT Southwestern Children's Health, seeing new and follow-up patients, performing all in-office food challenges, and participating in research trials. She's currently the co-chair of Allied Health for the Quad AI. So welcome, Maria.
Thank you.
We also have with us today Kathleen Hathaway, who is a nurse. She has gained her master's in communication at the University of Central Florida, baccalaureate degree in food and nutrition at Florida State University, and baccalaureate at Ohio University. Kathleen's interest in food allergy began long before her nursing career, she raised two sons with food anaphylaxis. She uses that experience and all three educational disciplines in her practice in the allergy clinic at Joe DiMaggio Children's Memorial Health System in South Florida, which offers a full range of food allergy services, including oral challenges, food oral immunotherapy, and clinical trials. She's a member of FANA, the college, the Quad AI, and Adverse Reactions Foods Work Group of the Quad AI, and FAIR's Education Advisory Council. She loves to provide professional and community education on food allergy and to empower patients to effectively make choices to manage their allergic conditions. Welcome, Kathleen, and thank you for being a FANA member as well.
Thank you.
So today in our session, we'll talk about, we'll hopefully empower participants with evidence-based strategies to enhance your clinical practice and patient education. You'll learn to apply tools and practices to conduct effective oral food challenges and utilize interactive resources like the Anaphylaxis Learning Guide to improve patient recognition and management of anaphylactic events in pre-hospital EMS settings, and engage in developing and sharing educational materials for both nurses and patients that align with your professional roles. All right, you guys all could see the learning objectives, which mimic the overall summary, and we will continue to our first question that I had prepared for our speakers today. So I'm just going to, oops, sorry about that. Can you guys see my slides still?
Mm-hmm.
Oh, wonderful. Okay, good. So, Kim, I want to start with you, if that's okay.
Sure.
All right. So with your expertise in oral food challenges and your work on the Quad A education series is clearly very impressive. I actually took it as soon as it came out, so it was amazing. I think very, very helpful, and I really thought that would be a great resource to share with everybody else within our community and hopefully beyond. So, can you share some key, updates or advancements in conducting oral food challenges, and how this might influence daily clinical practice for nurses and the development of the course that the oral food challenge course? And of course, we can talk more about as we see more and more standardization in oral food challenges, the advice that you may have for nurses to make sure that they conducting oral food challenges safely and effectively.
So first off, this oral food challenge course, this series, I get to be the lead author, but it was clearly a team effort. It takes a lot of brains to do something like this. We based this off of, there was an existing course, but there's been a lot of updates from Quadii from the I'm trying to update from the last time that we looked at this. I'm sorry, my brain wasn't working there for a minute. And the what we came up with was a 3-set course talking about food challenges. The first section really does talk about preparing your patient, choosing the right patient, and we really brought in a lot more of the psychosocial piece of this, which I think is underappreciated. And something brought in a lot of tools so that people can look at anxiety in their patients, try to figure out whether the patients are ready for a food challenge. And then we talked about the nuts and bolts of conducting a food challenge. How do you set up an office? If you've got depending on your practice setting, how do you set this up? How do you run safe OFCs? What do you need to prepare beforehand? So a lot of very, I think, hands-on, very logistical approaches to doing food challenges in different settings. And then the last of those 3 series is all case studies. And the goal of the case studies is to run people through scenarios. Okay, you've got a 2-year-old coming in for a baked milk challenge and this happens, and what's your next step? What do you want to do? What are you seeing? And then you want to proceed. Do you want to go from here? So it takes probably 15 different food challenge scenarios where each step is a learning opportunity and hopefully prompts some kind of conversation. So as a series, it's broken down into 3 steps just because there's so much information. But the goal of it was to bring in very hands-on, how do you do food challenges in different settings? And what are the different roles of the different people in the office? And with the understanding that not every office is going to have, we have all nurses, and, all of everybody on our team is an RN and or a nurse practitioner. And that's not realistic. Not every office has that same setup. We're extremely lucky. We're a research group. It's just a different setup for us than it is for somebody who's doing food challenges in the community. But these are the roles that need to be filled. This is how you do food challenges safely. And then, break it down into, if you're going to do a baked egg challenge, these are some ideas for recipes, and how do you get kids to eat these challenges? And, how do you look at a kid and decide whether or not there's a reaction brewing, or are you to a point where you need to stop? And then once you've finished the food challenge, how do you talk to people about the results of that food challenge and what does that do for their lives moving forward? So that was the goal of this. And we talked earlier about the Practol guidelines and the impact of the Practol guidelines on developing a course like this. And Practol was invented way back, 2012, which seems like a long time ago, to try to standardize food challenges so everybody was doing them basically the same way. We could compare results across different research projects. So Practol is very focused on double-blind placebo-controlled food challenges as opposed to open food challenges that you would do clinically. but the idea is still the same. We all need to be working off of a shared set of guidelines, both for interpreting the outcomes, and probably the most important thing is safety, patient safety. The piece that I think we did add with this OFC, the Quad AI OFC program, was the psychosocial prep piece and evaluation piece that has been, I think, underappreciated.
I thought it was a nice touch actually that you had that included.
Yeah,
Yeah.
we have the resources, right? We've got a lot of people in Quad AI who are bring their specialty, bring that to the specialty. And it would be silly not to take advantage of a group of people that they know what they're doing. They know they have a lot to bring to the table. They brought in a lot of really cool tools that I think are really, really useful and easy for people to use. And it just makes the whole experience much more positive for the family and certainly for the kid. And same thing with nutrition. We were able to we have a lot of dietitians, that have worked with us within the allied health group at Quad AI, and several of them worked with us on this food challenge course as well. And again, that's a specialty that's, what they bring to our specialty is so very, very important and sometimes underappreciated.
Yeah, thanks. I would like to see if Maria or Kathleen would like to chime in, because I know you both were involved in helping on this project.
Yeah, I think I just echo everything that Kim said. And I think that this module is great for regular staff. It's great for new staff. We have a new nurse in our clinic right now, and she's starting to do food challenges. And I'm already starting to have her work on this training module, because unless you're doing it on a regular basis, there's all these little parts of food challenges. There's things that come up that you don't know unless you've been doing them for a long time. And so I think the cases and just how to prepare the office, how to be prepared in case of a reaction, all of that information is really helpful, and is a great resource going forward for any kind of food allergy nurse. And I just think it was a really needed resource that we didn't have. We had the basic medical information about food challenges, but we didn't have the real life hands-on information. And that's what this gives to nurses, I feel, or any staff doing that.
Right. And as a nurse practitioner, how do you see that? I would imagine that probably be helpful for NPs as like
right. For NPs as well.
Right.
Exactly. Definitely for nurse practitioners or anyone that's doing them. Any new providers in food allergy, I think, is extremely helpful. If you're completely new to food allergy, everything's going to be foreign. So this really does help kind of guide you with that.
Yeah, and I agree with you. There's a lot of nuances when you're actually doing it that things come up. And even within the course itself, I remember taking it, some answers weren't really black and white answers. There's a lot of variability.
And it starts a conversation, right? I mean, and that was part of our goal was there's some stuff that's cut and dry, really, but a lot of it is in your setting. Does this work? Or in your setting, consider this. We have an ER across the street. We can do high risk challenges, and we should, right? We're a tertiary medical center. That's what we're supposed to do. But in the middle of Kalamazoo, Michigan, you shouldn't be doing high risk challenges when you don't have an ER in your backyard.
Yep, I agree with you. Yes. Kathleen, did you want to say something? I know you're nodding your head.
Well, I found some of the office preparation sections that are very specific about management of anaphylaxis. What are the supplies you need? Do you have a flow sheet to track symptoms and treatments as you're going? I mean, those are really nuts and bolts that make it very doable. And I love the case studies that are in the third section. And we've found those super helpful in training new nurses that are coming to the clinic that will be participating in oral challenges, because they really need those decision-making skills about when do I get a provider? When can I proceed? when do I need to think about repeating a dose? And I think those case studies really give you an opportunity to practice those decision-making skills in a place where if you make a mistake, it's okay, and you can learn from it without having a patient having to pay the cost for it.
Agreed. And I think one of the things, I mean, this tool is very good, and tools like this are very good and very comprehensive. I think one of the things that we realized is going through this is that I don't think that you can take any tool and go into an environment where there's not someone there who's done food challenges before and use this tool and say, okay, here, read this, and this is, then you're ready to do food challenges. Just, here's your tools, go through. And I don't think any of us, I just don't think you can invent that tool. I really don't think that we're ever going to be able to replace the hands-on, observational, supportive teaching that we all do in our careers, but especially for food challenges. I just don't think that I don't think we're ever going to be there. I don't think you could invent that tool. I don't think we can write that tool.
Yeah. It's interesting you say that because like even in informatics, we talk about data, information, knowledge, wisdom, and that wisdom piece that comes with experience and comes with seeing this every day. And this tool, I think, is a complementary almost in a way. It's like it's not a Bible. It's more of a, an adjunct to whatever you're doing to help, new nurses who are in that field, in addition to these, senior nurses who've been around to kind of guide those newbies, right?
Yeah. Yeah.
Right.
And I mean, isn't that what nursing does? I mean, isn't that how we all were trained?
Yes. Yes. And
Yeah.
actually, we're going to get to that piece in a little bit about the mentorship component, because I think that, we're jumping a little ahead. But I do have a question for Maria next. So if we could just go to the next slide.
Sure.
And so Maria, I think for you, I wanted to just see, in terms of oral immunotherapy, I want to touch a little bit on that as well. We know it's kind of a very rapidly evolving area of food allergy management. And from your NP perspective, would you be able to share some of the key takeaways from the oral immunotherapy for treatment of food allergy 2023 update, and also, the course, and discuss some of the resources that nurses can use to incorporate OIT in their practice?
Yes. So this is a quad AI module that has a pre and post test. It's actually very valuable if you are doing OIT in the office. In our office, we were primarily doing it as research-based, and I talked about this a little bit before, but now we're starting to really offer this as a treatment, especially for younger kids whose immune systems are easier to change at that age. And so I felt like this is a great resource for nurses and nurse practitioners and any providers, because it does go into when would you decide to do OIT, and it talks about how selection of OIT candidates is really important, and that you want to make sure you're taking a great history and also doing the testing first. And that if there's any doubt or it seems to be low risk, to consider a food challenge first, since OIT it's a lengthy procedure. It's time consuming for families. Because if they pass, then they can just introduce the food. So it talks about what are good candidates for OIT, and these would be patients that didn't tolerate a food during a food challenge, that maybe had a history of a recent reaction, or even it talks about patients that for years have had high levels and just never had a reaction, never ate it. That could be considered. It also goes into how to pre-screen so that you're not taking on like a risky patient, and making sure that their eczema and all their atopic diseases are well controlled, especially asthma, that they don't have EOE or any kind of symptoms like that. And just like the World Food Challenge module, it has some great like little cases with question and answers, like, is this a good patient for OIT? Would you pick this patient for OIT? And I think that really helps a provider or a nurse decide, oh, is this safe to do? And there's references in it as well. It talks about shared decision making, since this is such a big decision, and how families need to be aware of all the benefits, the side effects, any kind of burdens, and that practitioners and nurses should be talking to families about all the aspects of OIT, what the time frame is, that you're likely maybe not going to be eating this freely, but you're going to maybe be eating a larger amount of it. Talking about desensitization, how this could improve your quality of life. You might not have to worry as much about accidental ingestions. It also talks about bringing up financial considerations because these patients do come in frequently. So they may need to be paying co-pays every couple weeks. Talks about how you should consider social situations and family dynamics. These should be reliable families, and they usually are the motivated families that you're going to consider. And that also you want to talk. It talks about how you need to make sure that the facility that you're doing the challenge in is equipped to deal with anaphylaxis, and that you should have all the materials available and medications available. It takes a lot of rooms and a lot of staff for this and a lot of time. And there's also often a lot of phone calls and questions after hours or just daily, and talks about how you should have access to EMS and emergency transport if needed. It even goes into coding, and in the beginning, it does talk a little bit about just the timeline of food allergy, and it talks about the first FDA-approved peanut powder and just future potentials of OIT with other treatments like biologics like omalizumab, which we've seen great results with, and then how they're still researching other biologic therapies with oral immunotherapy. So just another treatment for families that are avoiding foods, but just making sure that these are the right families and that the families are aware of what the whole procedure is too.
Great, thank you.
You're welcome.
Kim, Kathleen, did you want to chime in any way?
I think the coding piece of it is it's important, and it's hard to do. I think trying to find somebody who knows coding well enough to come in and guide when we were trying to write the oral food challenge series, and I know other series that we've worked on, trying to find people who know how to do the coding is challenging.
Yes.
But Maria's right, man. This is such a time, the time commitment from both staff and certainly the families.
Yeah. Thank you.
Yes, I mean, I know it's time consuming. I have a couple families doing it right now. They're younger kids, and just, with illnesses, and sometimes the doses need to be skipped. They got to come in again. Parents having to take time off after they just had another baby. It's hard on them. So it has to be the right patient, and you have to give them all that information up front before you would start something like that.
Yeah, thanks for saying this, because actually we have Dr. Herbert, who's going to be joining us in a couple of months, specifically because that is such a big component, the psychosocial piece when it comes to OIT, oral food challenges, and the novel treatments that we're now implementing in practice. So I think it's becoming such a big issue in practice that it's important that we all are well aware as nurses, because then we can make proper referrals and follow-ups for those individuals and those families. So I'm actually looking forward to her presentation, because I think it will be very informative for us as well.
And I would just kind of echo what both of you have said. Patient selection is super important when you're looking at a treatment option. And we actually started our food OIT program in 2019 and kind of really had it up and running just about the time the pandemic hit. And so we had to learn a whole lot of things the hard way. But we really have learned, I think, a lot about how to educate families and help them really understand the program that they're taking on, because it's a daily dosing program. We're expecting our families to make medical decisions every day. They need to know when to call. They need to know when to send a MyChart message. They need to know when they can just carry on. And there's a lot of subtleties, I think, to each of those scenarios. So I find the course very helpful in helping tease some of those things out. And Maria, you mentioned the research, the reference list at the end of the course. It's phenomenal. So I think for people who are looking to really understand the evidence for oral immunotherapy, that reference list is a great starting place.
Excellent. Thank you. Well, let's move on. Kathleen, I'd like to direct next question to you. Given, from your bio that you have this unique combination of professional experience and personal insights as a parent, and how has this shaped your approach to food allergy education? And, how do you leverage this perspective when you either design or contribute to those educational materials that resonate with both nurses and patients? And what strategies do you recommend for using those interactive tools we are, describing today, and also the tool that, and I know I was part of that effort for the Anaphylaxis Interactive Learning Guide, but I know you've also you tinkered with it, right? So I would love to hear your thoughts about that, and how can we recognize in managing anaphylaxis? I think is a very important piece, whether it's during OIT food challenges or at home. So I know this tool is more for pre-emergency, pre-EMS use at home, but I think it's all from a holistic perspective. We look at it as what we teach them in the clinic, and then hopefully they take those skills home and they're able to then manage effectively on their own.
Agreed. And when I started my parent food allergy journey, the biggest challenge was just the lack of resources, because we were kind of at the very beginning of this whole wave of kids with food allergy. Now I think we're kind of at the opposite end of the spectrum. There is so much information out there that families sometimes wade into information that's not really evidence-based and not medically and scientifically vetted. So I love that the Academy has invested in a tool like this Anaphylaxis Interactive Guide. It's very practical. It allows families to kind of learn in an interactive way, but also a very concrete way. I guess one of the moments that I felt like I could finally breathe as a parent was when we got our first asthma action plan, because I had 2 kids that had asthma along with their food allergies, and I just never felt sure about when to use what medication, when did I need to call the office, when did I need to just head for the emergency room. And with having this concrete guide, I finally could just look at the list and go down and say, okay, here I am. This is how I need to proceed. And I feel the same way about our anaphylaxis emergency care plans, that we give our patients really hands-on tools. I had a patient start omalizumab today in the office, and we used, one of the advocacy organizations recognizing and responding to anaphylaxis tools. And we could literally go down the list and, if you see these symptoms, here's what you do. If you have this set of symptoms, here's how you would proceed. And just having that very clear cut, easy to use, hands-on type of educational tool is very important.
Thank you. Maria or Kim, do you have any other thoughts? And again, this is just one of tools that I know the COD AI has invested in, but if there are other ones that you may want to bring to light.
I just want to, totally agree with Kathleen. When you've got a form that you can use as part of your teaching and reinforce your teaching, and something, it gives people power, right? It gives the mom and the family and the I can't call them participants because I'm in research, the patients, the power to control or to be in control. And what a great what a great tool.
Thank you. We do have a hand up. Kim, would you like to unmute and ask your question?
Sure. Can you hear me okay?
Yeah.
Oh, yay, my microphone decided to work today. That's always a good thing. And my question might be a little bit premature, but it crossed my mind as you're talking about the learning guide. So I'm a pediatric clinical nurse specialist at Children's Wisconsin on the inpatient side. And if anyone's worked inpatient before, you know that, anaphylaxis is rare, but of course it's something we want nursing to recognize and act on quickly as we do in any setting. And we are embarking on some refresher training for our inpatient nurses. We have about 500 of them. And I would personally love to spend an hour on anaphylaxis, but I probably won't get that amount of time. And likely our training is going to be virtual or kind of self-guided online module type learning. And wondering if there's a particular, whether it's this learning guide or other tools out there. I know FAIR has some online learnings on their website that are, I think they're each about an hour long. So again, we're trying to kind of piece things together that could be a quick review for staff, and didn't know if you had anything you'd recommend.
I will just mention real quick, and not to take away from the speakers here, but we are planning to have Dr. Tim Dribbin join us for one of the sessions. And I recently published the new consensus report on anaphylaxis. I think it's in January 2025 publication. And so we're hoping to have him, and you're welcome to, of course, invite anybody who wants to join this session with him to learn about anaphylaxis updates. So that's just one opportunity, but I'll let Kim and Kathleen and Maria, talk about other ones that might be available.
I think part of the, especially for inpatients, one of the DNP students I was working with, it turns out that one of the major, let me see how to say this, one of the meds that is responsible for the majority of the med errors in the inpatient setting is epinephrine. And it's because it comes in so many different concentrations. And to try to alleviate that, Hopkins actually started putting auto-injectors in the crash carts, so that you have the 1 to 10,000 that you're going to use for IV, and then you've got an epi auto-injector to use if you're going to go IM. What they didn't realize is that you put whatever you can find in those kits, and always use the cheapest option, because of course we do, and no one knows how to use the devices, and they're not putting IVQs in there, let's be honest. So her project was actually putting together really quick videos on how to use the auto-injector devices. So I think in part of your training, Kim, when you're going through with your inpatient nurses and staff, is getting or at least acknowledging the fact that there's some training involved with using the auto-injectors. I think all of the different device sites, you can pull training off of their publicly available sites and use it. I think that's meant to be it's meant to be used like that. But I think it would be worth pulling some of that down, even if you only can spend a couple of minutes, but going through some of those training videos on how to use the auto injectors, and maybe even include the NEFI training, seeing how that's coming to be, and something that everybody should know at least how to pick it up and how to use it. But yeah, I clearly are going to spend a lot of your time on symptom recognition, and how do you get here from there. But the spending some time on how to use the devices and how to administer epinephrine is probably going to be some big part of that training.
Yeah, thank you. We actually have in our code carts, we actually have vials of epinephrine, and we don't have auto injectors. And it's something I'm working on. It was cost prohibitive years ago, and now that the cost of auto injectors has come down, But yeah, that's a great idea because then of course we send families home with auto injectors and there's the variety of them and the nurses are like, what is this? How do I use that? Yeah, so that's a good idea to pull videos off of the manufacturer's websites.
Thank you, Kim. And I wanted to move on to our next slides and just talk a little bit about ways to engage and to contribute. And my question is sort of like for all of you at this point is collaboration and mentorship are vital in advancing food allergy education. And I think just having us today, nurses that are very much involved with the CAUDA community and also with the Food Allergy Nursing Association community coming together today for this educational forum is one of the examples, right, of how we can move our shared goals and aspirations forward in improving patient outcomes and quality of life, et cetera. So what examples or can you share from your end in terms of mentorship and professional relationships that influence your work? And what advice would you give to nurses seeking to engage in these opportunities?
Well, one of the things that I can share is I actually met Olga at a fair summit, and I went there, thinking I want to try to find some nurses or find ways that nurses can contribute. And so I got in the little line to talk to the speaker, who was a fair staff member, and Olga happened to be a couple people behind me in line. And so the speaker introduced the two of us, and it has been an amazing collaboration to be part of FANA and just to grow. And from that same meeting, I actually made some connections that ultimately led to my participating in the Educational Advisory Committee with FAIR. So I think even if you're a shy person, just participating in meetings and really making the most of it and talking to the people that are there will open all kinds of interesting opportunities to you.
Thank you. Yeah, I remember that, Kathleen.
Yes.
It was in Florida.
Yes.
So, yeah.
And I, because I'm on a university campus, I have access to the School of Nursing students, and I went to Hopkins Nursing School, so I still have some contacts. So I get invited occasionally to come over and do talks with them, and that's a great opportunity to reach a wide audience because food allergy and anaphylaxis management and teaching families on how to use that. None of that is part of standard nursing education. It just is not. Yeah. So unless they invite a speaker in to talk about these really, I guess highly specialized fields, the nursing students are never going to hear about it. But so that's a fun. I enjoy that a lot, and I always feel like I've made some difference when I get over there and talk to like the whole class of them all together.
Kim, you're so spot on. It's interesting because undergraduate curriculum still has abysmal amount of information on food allergies. I mean, we do talk about anaphylaxis just a little bit, but not much about food allergies. And it's a little bit more prominent in maybe NP track just because anaphylaxis is, and again, I don't know if it's food allergy specifically, but probably more like anaphylaxis. And I would probably defer to Maria to confirm that because they do deal, this is one of the emergencies that they have to deal with. But other than that, it's really very almost non-existent in the nursing curriculum, and it's a problem. Yeah. So I think it's another untapped area that we all have to eventually look into and try to address from the curriculum development standpoint. I see Darren's hand is up.
Yeah, I was just going to respond to Kim's comment in that in Australia, ASCII, which is our main allergy body, like Quad AI, because they're doing a huge amount of projects, etc., with this $26 million of funding they got a couple of years ago, they surveyed around um, to all sorts of educational bodies about how much anaphylaxis or allergy training was in the undergrad program. And of course, I know from my involvement with my university, where we actually have anaphylaxis within the pediatric component of our course, the minute I got involved with that course, it went into the asthma chapter. Because that was the most appropriate one, and that's been very successful. It's usually part of their scenarios, but every other there's very few. Well, there's no other undergrad universities within Australia that have got it within the curriculum, and unfortunately, even Askia have got this idea that within a university program, you can just create the module and shove it into the undergrad program, and of course all of us that have been involved with academia know that these things take 12, 18 months to get through, and then the whole curriculum's overburdened. And we see it as really important. I mean, it is a major medical emergency, but not everyone in the boards and the world see it that way. Ironically, though, of course, how many cases of anaphylaxis actually happen on university campuses annually? Quite a lot, or enough that they should be taking notice. So, yeah, it's an interesting a dilemma, I think. So, finding it in the space in the undergrad program globally is a big challenge.
Well, just to add to that, Olga, you had mentioned about like MP curriculum, and I don't know exactly what the curriculum is right now for MPs, but I precept a lot of nurse practitioner students, and usually ones that are interested in allergy, and they really aren't receiving any exposure to it at all. I even feel like a lot of the physicians around me that are in different areas, like ENT and food allergy, anaphylaxis, it just seems so foreign to them. So I think there's a huge need there in nursing school, nurse practitioner school, physicians probably as well. But I think that, doing your little part, educating whoever if you can go out to schools and educate, we do that a lot. We do that a lot with our hospital. We often go to school nurses who also, a lot of them often don't feel very comfortable with anaphylaxis when they're going to be exposed to it more than probably most, and try to do our part in ways, joining the Quad AI. And Kim and I are very involved in the allied health group at the Quad AI, and getting involved, like Kathleen said, even if you're shy, like I am too, just reaching out to one of us. We always want volunteers, and getting involved. You can collaborate with us. You can work on these projects. You can get involved in things like these modules. All of those things can help, our ways to engage and contribute to food allergy.
Yeah, that's great. I agree. So, and one of the reasons why this group was born is because we felt that in nursing education and in nursing in general, there's just such knowledge gap on food allergies that nobody was addressing. And we're doing our little thing here and there, but on a larger scale, we're still not solving the problem at the core, which is integration of those allergy care competencies on the undergraduate and graduate curriculum. Because once you address that, you are cultivating a more allergy-informed nursing workforce that then can be prepared to serve the population, no matter what settings those patients end up, because eventually those patients will end up in, cardiology or oncology or,
When I think too, back in the dark ages when I started doing this, this was seen as a pediatric problem, right? This was not something that was seen as an adult problem. Clearly, there were adults with food allergy, but not, we just didn't hear about them. And with the increased number of diagnoses every single year, and and those kids grow up, they always do that. And now there's a pretty significant, clearly an adult population of food allergic people, and so you're going to run into them in the inpatient setting, where you run into them in the outpatient setting, the school setting, the work setting. I mean, it just, it's blossoming, and having just some basic information available in the curriculum for nursing would be appropriate.
Yeah. Well, speaking from I guess putting my academic hat on, that's where I see some of the solutions possibly coming, into is the academia, and then hopefully that will then prepare a whole new generation of nurses that are actually somewhat informed on food allergies.
Or at least acknowledge that this exists and is something I should know something about.
Yeah, exactly. So that's one of the things, and of course we invite collaborations on this because this is something that we're doing through Food Allergy Nursing Association, and also welcome partnerships and collaboration from our colleagues, from the college, the Quad AI, World Allergy Organization, our colleagues overseas, because I think it seems to be a global issue. It's not something that's just limited to the United States. So anybody else wanted to chime in on this before we move on to the next question? All right. So I know we're kind of coming close to the end. I just wanted to see looking into the future, because I know some of those tools that we were talking about today, clearly we utilize technology to deliver that education because we realize that the future is now online. And how do you see technology playing a role in food allergy education? And are there any other emerging tools or resources you believe will significantly impact clinical practice and patient education in allergy and immunology?
Well, just in our clinic practice, we are an Epic hospital, and so we rely heavily on electronic messaging with our patients, and we use it for education and preparation prior to oral food challenges, prior to starting OIT, follow-up visits, and even links to educational materials that are online is one of our favorite ways to send things. And it just makes it so that material is available to our families in an enduring way, as opposed to a paper handout that who knows where that ends up. But they can always go back and search their messages and find the links that they need. There's a conference that's held here in South Florida in January every year, and it's really easy to get a lot of great speakers to come from other parts of the country that are cold.
From the cold parts, you can say.
Yes. And one of the ideas that was shared there was actually building in to an electronic medical record some of the food allergy, anxiety, and quality of life instruments. And we're sending out questionnaires about, what kind of allergens, environmental allergens are you exposed to in your home? But for someone with a food allergy diagnosis, we can actually pre-screen as part of our pre-visit questions. And it gives us information that we can action then right in that visit. And I think that's a great opportunity that's available to us now.
That's true. It's interesting. I was recently speaking to someone in Microsoft because, some of the tools that they're developing and some of their physicians and NPs are using them already, like ambient listening, for example, right? And what's interesting, I was saying how with labels, because nowadays we see a lot of things that are fortified foods, right? With things that you wouldn't imagine even being in some of those foods to begin with. Like, when you have fortified, I don't know, orange juice or milk with omega, fats, and all of a sudden you find fish tilapia oil or, things that if somebody's allergic to it and they end up ingesting it, depending on how severely allergic they might be to that product. But it's just interesting to see that we also know that you got to feed those individuals in the hospital setting, right? 3 times a day. And you have to make sure that everything, and I always say the buck stops with the nurse, because we're the ones at the end of the day take the hit, because whatever goes inside the person's body, we're responsible. So we can't just say, oh, I didn't know. So we always have to go and check whether it's labels for medications. We also know that some medications have certain allergenic components that some people may have no knowledge to or not. So for us, and I was saying to them, we have all this technology. Why can't we figure a way where AI could scan the labels and knowing that there are allergens already in, but in the EHR, it could just cross-reference and will hopefully spit out an output saying, be cautious with those products because they have these allergens. And they're like, oh, Olga, this is brilliant. We could definitely build this because we have capability. And I said, oh, that's so great, because I said, I'll be the spokesperson for that. So, but the fact of the matter is that we have the technology, it's just not being utilized because they don't think of all the cases that they could be used for. And as clinicians, that's one of the things that I love as part of, I guess, different hats that I wear, is being at the table to bring those ideas forward so they can build this for us, because that's so important that we have that nursing bridge between technology and clinical settings so we can make some of those things more automated and easier for us and for the patient. So anyway, just wanted to share that example because I thought it was it just came in the regular conversation. It wasn't even like something I was paid for to do. So
I don't know if you mentioned AI, and one of the physicians I work with has recommended Open Evidence, which is an AI tool that's through the New England Journal of Medicine and the Mayo Clinic. And that's actually very helpful. I don't use it that often. I'm just kind of looking at it right now, but they even have lists of like create a patient handout on that. And our hospital is actually doing something right now with AI and Epic, where I believe we're going to be able to just like have our note completely done before we leave the room, so that we can be more efficient and start seeing more patients, or at least, being a little more productive with the patients and getting more access to care.
Yeah.
So it's all these things are changing.
Yeah.
And these are good things in a way that it reduces the wait times, because if you're more efficient, you could see more patients, the wait times is less, access to care is quicker because, then patients don't have to wait. Like I know Jaffe, for instance, right, Institute Mount Sinai, sometimes patients wait 6 to 8 months to see an allergist.
Oh, at least. Oh,
at least.
Yeah.
Yeah. And I'm sure
our
John
wait
Hopkins
time is ridiculous.
Yeah.
It's terrible. Yeah.
Right. And so this is really a problem. And we know that for some of those children, there's a certain window, right, where they can get some of those treatments in before they pass their teenagers or before they go to college. And so some of those nuances, I think it would be great if we have technology to help alleviate some of those burdens and streamline the processes. That'd be great. Well, I know we have almost at the time, so I just want to see if there's any last minute thoughts. Maybe each one of you can just take a couple seconds, a few seconds to share last minute thoughts that you want to impart onto our members.
One of the members mentioned more funding for nurse research would be valuable.
Yep.
And I think that would be great in food allergy.
I agree.
Yes, for sure.
So we can implement the competencies into undergraduate curriculum.
Exactly.
It's our next careers, right?
Yeah.
Right? No, this is great. I think there's a lot of tools online. There's a lot of resources for food allergy. Quad AI, college, your page, your groups. Just Quad AI has journal clubs. There's webinars all the time if you're a member. And I believe you can still do some of these modules. You may have to pay a little fee or something.
There, I think, to get behind the paywall, I think, but it's not outrageous.
No, not too much.
Yeah. And then you do know that you're getting high quality, evidence-based learning, which is important, in the age of disinformation, making sure that your source is good, is critical, just critical.
Right. And for those who will be watching later, we do have all the links to those modules on Thana's website, so please check them out. They also part of the presentation, PowerPoint presentation, so you can access those links as well. And Kathleen, did you have any last minute thoughts to share?
Well, I think I've already said it once, but I would just encourage anyone who really has an interest in food allergy to join our professional organizations, whether it be FANA, whether it be the college, whether it be the academy. There is just such a wealth of information and also just collegial interaction that is available to us. And I think that we really become stronger by taking advantage of those opportunities.
Agreed.